Hi, Miss Perla. My name is Denise. I'm going to be your CNA today. It's time to do some exercises on your knee and your ankle. Would you like to do that?
Yes.
That sounds great. All right, let me just make sure your bed's in the lowest position. Make sure it's locked. And let me give you some privacy. Okay. What we're going to do is I'm going to raise you up to a nice level for the exercise, okay?
Okay.
And then I'm going to put you in supine position. You ready? Here we go. Okay. Now I'm going to uncover the leg that we're going to do the exercise on for the knee and the ankle. Let's just move it over here a little bit. How's that? Okay. Nice and neat. Okay. Now I'm going to exercise your knee and your ankle. First, we're going to exercise your knee. If you feel any pain when I'm doing the exercise, I want you to tell me to stop, and I will stop, okay? Are you ready to start?
Yes.
All right, let me put my hand under your ankle and under your knee. And shall we begin?
Yes.
Okay. 1, 2, 3. How's that?
Good.
Excellent, great. Now we're going to do an exercise on just your ankle. So if you feel any pain, I want you to tell me so, and I will stop, okay? All right. I'm going to put my hand under your ankle, and we're going to go. 1, 2, 3. How's that?
Very nice.
Okay, good. Let me go ahead and cover you back up. Raise your head of your bed back up. Let's make sure you still have your call light in case you need to call me.
Okay.
I'm going to make sure your bed is in the lowest position. Great. Make sure it's still locked. I'm going to remove privacy. And then wash my hands. Well, Miss Perla, I'll see you next time. Okay, bye.